have been putting off doing this video since December maybe, and I'm really just looking forward to getting this off my chest, I guess. Welcome back, this is Katie, and this is my life with VEDS, or Vascular Ehlers-Danlos Syndrome. Today I'm going to talk about my renal artery dissection, which happened in November last year. This is my first video in a while, and I'm finally ready to talk about this. First, I want to talk about what a renal artery dissection is. Now, this is a patient perspective. I'm not a doctor, so this is not where you should be getting your medical advice or anything like that. This is just my personal perspective as a patient on what these things are and how I think about them. So arteries have walls that are composed of 3 layers, and a dissection happens when the innermost layer of that artery wall tears or dissects. And that can cause a number of things. It can cause like a flap that can block blood flow. It can cause a bunch of clotting to the area. A pseudoaneurysm can form. There's a number of things that can happen like that. It's not a good thing to happen, but it's important to know that like dissections happen when it's basically an impartial tear through that wall. So like a full tear, all 3 layers, you'd be bleeding internally, and that's a tear. That's what I think of as a tear or a rupture. And then a dissection happens when that innermost layer of the wall tears and you still have the outer layers of the artery wall intact. So that's what a renal artery dissection is. It's an artery dissection that happens to the renal artery, and the renal artery provides blood flow to the kidneys. There's a left renal artery and a right renal artery, and the renal arteries are responsible for providing blood flow to the kidneys. So a kidney infarction happens when the kidney does not have enough blood flow to support that organ. And that can very easily result from a renal artery dissection because there's either a flap or some like clotting going on around the injury to the artery, and that can restrict the blood flow to the kidney, which is what happened to me in November. So my right renal artery dissected, and it resulted in a kidney infarction, and I lost half of my kidney. Half of my kidney died. I still have it, but it's dead. I'm distracted by a squeaky toy. I don't know if you can hear it, but hopefully you can't. So I lost half of my right kidney in November. It was spontaneous. So because I have VEDS, I am prone to spontaneous artery dissections and ruptures, among other things. And this happened while I was doing nothing to provoke it. I was playing my guitar and singing. Ironically, I was singing a song about VEDS. That has been a whole, I want to say mindfuck, but I don't know if I can say that word on YouTube. It has been it's really messed with my head. It really did mess with my head for a little while. So I was singing, playing guitar, just having a good Saturday. I had just done a live stream with Bella. We do a live stream. We were doing it every month on a Saturday, talking about our lives with VEDS and what's going on in our lives. And it was maybe a couple hours after that live stream where I was like playing guitar and singing and having a great day. And all of a sudden I felt this I was singing and I felt this it felt like a grab, like a twist, really intense pain in my right flank. And I tried to ignore it, hoping like it was just the way I was standing. So I remember trying to like change the way that I was standing in order to hopefully make it go away, like hope that it was a muscle spasm or something, but it was definitely not going away. And I couldn't finish the song that I was singing, and I put down the guitar and I ran out and called my husband, and I had started to really feel like an excruciating amount of pain, and I knew something really, really bad was happening. So my husband came down, and I was pretty much like, I was telling him to call 911, and I was pacing around, couldn't get I was trying to find a way to relieve the pain, but I was kind of like hunched over. I've actually was hunched over this couch at one point, just leaning over the back of the couch, yelling and crying, and it was, oh God, it was something else. So then I felt suddenly that I had to go to the bathroom. I went to the bathroom, and then I started peeing blood, And then I knew for sure that I was having a kidney infarction and a renal artery dissection because I'm unfortunately very familiar with those symptoms. I haven't had one, but I've talked to many people who have. And I also have read a lot of case studies on VEDS and I'm just familiar with those symptoms. So my husband called 911. We got me upstairs. We were waiting for the first responders. We called my doctor to let them know, like, please call the hospital. And I remember, my husband had my geneticist on the phone on speaker, and I'm just yelling like, kidney infarction, kidney infarction. Oh, it was so bad. It was so bad. And then the first responders came, and I told them I'm having a kidney infarction and my renal artery dissected, and I just know it, and they're, of course, trying to get me the care that I need. I was in so much pain, so much pain. They got me to the hospital, and a CTA did show that I had a renal artery dissection and a kidney infarction. So at that point, I think it was about a third of my kidney was blocked, didn't have blood flow. And that's what was causing all my pain. And that was what was causing, the blood in the urine, was that I was losing that part of my kidney. And that hurts really bad. So they admitted me. I stayed for, I think, a day and a half or so, and my pain was like under control finally, and they sent me home. And then I think less than 2 days later, the pain returned like really bad. And I knew, like, I just felt like it was happening again and that I needed to go to the hospital. And I had another CTA at the emergency room that showed that the dissection had spread a bit, and the kidney, like, I had lost more of the kidney. So I think at this point I was about half of my kidney. So I was admitted, and this time I stayed in from like the 7th to the 13th or something of November. It was almost a week. And overall, I went in on November 4th. It was almost 10 days, I think, in the hospital. I'm not going to talk too much about the experience of the hospital because I still have a lot of negative feelings around that. And I'm not quite ready to go there, but it was pretty bad. I will say that they didn't want to give me pain medicine, because opioids, because when they scanned me, they saw that my GI system that I had stool backed up to my stomach. So that they were worried about a bowel perforation from giving me any kind of opioid. So for a while, they tried to manage my pain without that. They tried to give me lidocaine patches and ice packs, and I just remember the absurdity of the whole thing and feeling like I couldn't function. My blood pressure was higher than normal. I was crying and yelling, and I was in so much pain that I was nauseous, and I just it was absolutely horrible. Absolutely horrible. Eventually they did give me the Dilaudid because nothing else would work. They tried hydrocodone, I think, and it made me really itchy, so it was like, that's not going to work. Maybe it was oxycodone. Yeah, it was horrible. So then, we just kind of waited it out. It could be more dangerous for me to have surgery than somebody else without VEDS. So the plan was to just leave it in there, support me through the kidney dying, and then, once I was stable, send me home to finish recovering at home, which I feel like was a totally valid plan. I just didn't get the pain control that I really needed. So it took a while to get through the pain. It was very, very hard. Eventually, when they gave me the Dilaudid, my pain became under control for the most part. We had a couple pain breakthroughs when they took away the pain pump that I was on. And, again, it was just so bad. I ended up having another CTA. I had 5 CTAs within the course of 10 days. It was it was a lot. But when you're in an emergency, there's no other scan that they really do to see your arteries. One thing that came up on that scan was a few days into my second hospital stay, I had a new iliac dissection on my left iliac artery. And that's totally new. I didn't have it before. That happened while I was in the hospital. And I'm going to talk about that in another video because that's been a whole other thing that I'm dealing with. And if people are searching for just an iliac dissection video or just a renal artery dissection video, I want to make it easy for them to find. So on November 13th or so, I was discharged from the hospital. I had a number of pain events while I was in there. I had a gallbladder attack. I had a left flank pain that I thought was a dissection. And then I came home and I've been recovering at home. And once the pain subsided, it was pretty good. Kidney function is normal. So that means that the 1.5 kidneys that I have are functioning well and doing their job. So that's great news. The mental recovery has been a lot harder. I came home and I was like really tired and really sore and super, super depressed. And I think it was the combination of the renal artery dissection with the iliac dissection and all of the things that I went through in the hospital and the trauma there. And it's been very hard to work through, honestly. But medically, I'm pretty relatively stable with the renal arteries and the kidney. That left flank pain that I had in the hospital, I think was a left renal artery dissection, but we don't really know. One day after I came home from the hospital, it happened again very suddenly on the left flank, and went to the ER, and they couldn't do another CTA because I'd already had 5 in 10 days. So I just recently had my follow-up MRA for the renal artery dissection and the iliac dissection, and I'm still waiting on results. So we'll see if there's anything new there. I wouldn't be surprised if there was. But hopefully it'll show that the right kidney is stable at half of its normal, half of its original livelihood. I don't know how else to put that. If you've had a renal artery dissection, you know how painful it is. Let me know in the comments if you've had one of these and how long it took you to recover. It was a while for me. And yeah, I'm sorry you went through that. It is the most excruciating pain I think I've ever felt. Like when I had my carotid artery dissection, I thought that was really painful. When my spleen ruptured, I thought that was pretty painful, but I was able to get through that. This, I could not function. Like I was dry heaving and screaming and crying for days. So if you went through that, I'm really sorry that you went through that too. Let me know in the comments. It's been a huge thing for me to kind of talk about it, especially in this space. I've been avoiding this space in here. And here I am confronting the space, talking about what I went through, and hopefully moving through the next step of feeling better mentally. Thank you for all your support, and I'll talk to you soon.